Okay, we're at what, 6 months with this pandemic, staying inside, social distancing, and when you are able to go outside wearing a mask, let's face it, it's affecting our mental health, right? So, what we wanted to know from doctors, what are they seeing in their patients, and how can we all improve our state of mind? Jess Arnold joins us with the answer. Jess, first off, how are you doing, and what did you find out?
Thanks for asking, Bruce. Doing okay. It's nice to be able to get outside and not sweat anymore. But I do want to tell you about this CDC study that they put out in August because it really is telling in terms of all of our mental state. It says that reports of anxiety and depression at least tripled from last year during the months of April to June. Now, the health professionals I spoke with today said that can be shocking, but there are ways we can help ourselves and each other. Our sources are Meredith Gardner, a licensed professional counselor and owner of District Therapy Associates, and Dr. Anisha Abraham, a pediatrician and faculty member at Georgetown. So, 6 months into the pandemic, what's the state of mental health in D.C., Maryland, and Virginia?
We have seen an uptick in referrals, especially probably in the last month or two.
She says adult referrals have been on a steady rise, and they're seeing more children coming in now that school's restarted. What are the biggest issues she's seeing?
Anxiety for sure, and more depression. I've been sort of terming it the COVID funk, but I feel like we're like in our own little Groundhog Day.
You know, the movie where the same day repeats over and over? Yeah, she says people feel stuck. So what could happen as the weather gets colder and days get shorter?
A lot of people experience seasonal affective disorder anyway, just when the days are shorter. Plan to be warm, but be outside, because I'm not sure being inside the whole time is going to be healthy.
Both Gardner and Dr. Anisha Abraham say we have to look out for each other. So what are some warning signs that a loved one might be struggling with a mental health issue? Dr. Abraham specializes in children's health.
If you have a child or teenager that suddenly decreases the social contact that they've had from before, they have a significant change in their sleeping or eating patterns. If they at all are referring to death or dying, that is definitely a warning sign of suicide. But sometimes you just don't know, and that's why having conversations and asking is so important.
How can you improve your own mental health?
A lot of the anxiety is just trying to manage what's in your control. And so I think that's what we do with a lot of clients is, okay, well, what can you control? And you can control trying to keep your routine.
Get out and exercise to make sure we're sleeping and eating well. Those are things that kids are looking to us in terms of how we're handling stress. And certainly if we can model those behaviors, it really helps them for their lifetimes.
And Dr. Abraham says the pandemic has had a positive side effect, the expansion of telemedicine. She says it's given more people access to resources like therapy. Now, September is actually National Suicide Awareness Month, so we want to make sure we give you the resources that you or someone you know might need if you feel you need help. So